Welcome to the penetrating trauma to the chest, abdomen, and extremities case from the case files book. And we'll continue now in part 3. So we reached the specific wounds management. Now we'll speak about the local wound exploration in this case. So the local wound exploration is probably the best initial evaluation for a stable patient with abdominal stab wound. This procedure is performed after preparing the skin with antiseptic agent and creating a sterile field and anesthetizing the skin and soft tissues with lidocaine and epinephrine. The skin laceration is enlarged and the wound tract is gently followed until either its termination or its violation of the anterior abdominal fascia. So the wound tract is gently followed until either its termination or its violation of the anterior abdominal fascia. An intact fascia connotes the unlikelihood of an intra-abdominal injury, and therefore the wound may be irrigated and closed. So an intact fascia suggests the unlikelihood of an intra-abdominal injury, and therefore the wound may be irrigated and closed. If the abdominal fascia has been violated, several options are available, including observation with serial exams, diagnostic studies including CT scan of the abdomen, laparoscopy, or exploratory laparotomy by an experienced surgeon. When the initial evaluation is negative, the test proceeds with installation of 1 liter of warmed saline, which is often drained by gravity and submitted for microscopic analysis. There is no clear consensus on the accepted criteria of a microscopic positive result, and the criterion may vary from center to center, ranging from 1,000 RBC per cubic millimeter to 100,000 RBC per cubic millimeter or 500 WBC per cubic millimeter. If the DPL, diagnostic peritoneal lavage, is positive, the patient should proceed to the operating room for exploratory laparotomy. If the DPL is negative, the patient should be observed for 24 to 48 hours, during which time antipyretics, antibiotics, and narcotic analgesics are withheld. It is critical that a surgeon becomes involved in the patient's care prior to a DPL, because other options including observation, laparoscopy, or laparotomy are possible in these patients. Microscopic hematuria in penetrating abdominal, flank, or back trauma necessitates evaluation of the kidneys, ureters, and possibly the bladder by CT, intravenous pyelogram, IVP, and perhaps retrograde cystography. Recent literature suggests that most renal injuries without associated hemodynamic compromise or urinary collection system leaks do not mandate exploration. CT scan may help to identify the wound tract and assess for possible intra-abdominal and retroperitoneal injuries. Good sensitivity of this test occurs when thin, about 3 millimeters, thin cuts are performed and read by an experienced radiologist. So good sensitivity of this test occurs when thin cuts are performed and read by an experienced radiologist. Specificity of a CT scan is excellent in identifying free air or free fluid in the abdomen. However, the study may lack sensitivity in identifying actual injuries to hollow viscera. Injuries to the back, physical examination, FAST, and DPL are all quite insensitive when it comes to injuries to the retroperitoneum, which includes colon, kidneys, and ureters. Patients may indicate a desire or need to flex their hips, and this may be your only clue to retroperitoneal process irritating the psoas muscle. Here, CT may be used to evaluate a wound tract, but still thin cuts and interpretation by an experienced radiologist are critical. The injuries to the extremities. The 6 P's of arterial insufficiency, which are paresthesias, pain, poikilothermia, pulselessness, pallor, and paralysis. These are the 6 P's of arterial insufficiency while examining the extremities or the wound to the extremities. The 6 P's are paresthesias, pain, poikilothermia, pulselessness, pallor, and paralysis. So these are the 5 P's of arterial insufficiencies. So these and the hard signs of vascular injury, such as pulsatile bleeding, these should be sought. These are indicators for immediate operative or angiographic evaluation. A careful pulse examination should be performed to look for a deficit. Sites of injury can be auscultated to identify a bruit that could represent a traumatic arteriovenous fistula. Similarly, Doppler examination of the brachial artery at the antecubital fossa and the palmar arcs can confirm flow or identify a bruit. So Doppler examination of the brachial artery at the antecubital fossa and the palmar arches can confirm flow or identify bruits. Additionally, a motor or sensory deficit can represent nerve or tendon injury that is best evaluated and treated in the operation room. So finally, we'll summarize the clinical pearls of this case. The systemic approach to the trauma patient is ABCDE: airway, breathing, circulation, disability, and exposure. A wound that does not penetrate the abdominal fascia may be irrigated and closed without further diagnostic studies. Penetrating trauma to the chest below the nipple line may cause intra-abdominal injury as well as chest injury. The FAST, focused abdominal sonogram for trauma, is fairly accurate in assessing intraperitoneal free fluid. Approximately 85% of penetrating cardiac stab wounds originate from the puncture to the cardiac box. Thank you very much for staying all the way to the end. Don't forget to like, subscribe, and share. And please do not forget the disclaimer. I read the notice again from the book itself. Medicine is an ever-changing science. As new research and clinical experience broaden our knowledge, changes in treatment and drug therapy are required. The authors and publishers of this work have checked with sources believed to be reliable in their efforts to provide information that is complete and generally in accord with the standard accepted at the time of publication. However, in view of the possibility of human error or changes in medical sciences, neither the editors nor the publishers nor any other party who has been involved in the preparation or publication of this work warrants that the information contained herein is in every respect accurate or complete, and they disclaim all responsibility for any errors or omissions, or for the results obtained from the use of the information contained in this work. Readers are encouraged to confirm the information contained herein with other sources. For example, and in particular, readers are advised to check the product information sheet included in the package of each drug they plan to administer to be certain that the information contained in this work is accurate and that changes have not been made in the recommended dose or in the contraindications for administration. This recommendation is of particular importance in connection with new or infrequently used drugs. Thank you very much for listening. Don't forget to study and revise and read very well and listen to my videos before your exam. And also do not forget to share, like, and subscribe. Shukran, shukran, shukran for listening, and bye bye.